introduction how important the unanticipated event or certain biological shock. And also I'm going to repeat this again for the practitioner. Your therapy will be most effective, whether it's acupuncture, chiropractic, any energetic work, when you resolve the conflict or when you end the healing phase. So now, I'd like to tell you just a little bit with Dr. Harmer. Dr. Harmer had dedicated his life to the betterment of mankind, and a few of you already know his story. But for tonight, before I tell you more about the history, we're going to focus on the 5 biological laws and how they relate to our evolution, how they relate to health, and the unanticipated event, the cornerstone of all things. Now, the G&M, as you can see on the screen, welcome everybody. Seems like there's more people coming in. Now, the G&M falls in the mind-body medicine. Now, a lot of you may have heard of Deepak Chopra, Louise Hay. I'm pretty sure there's wonderful practitioners in Australia. What's in the mind-body is very important. However, not having the background in German New Medicine, what's important is this work has no hypothesis. For the first time in medical history, even for natural medicine, it's the provable science. And it can be verified on 3 levels: the psyche, the brain, and the organ. Now, how did this happen? And how did it all get started? Just a little bit of the history. In 1978, Dr. Harmer's son, named Dirk, was accidentally shot. And you can read about it online or do a search of the Italian Prince of Savoy, the Isle of Cavallo, and it's, believe it or not, it's still going on, and it has a lot to do with suppressing Dr. Harmer's work. And you can read about it online, or I can cover that further in the webinar, but I want to get to the main meat of it. In 3 months after Dirk died, unexpectedly, 4 months later, Dr. Harmer developed testicular cancer. And it was since then he began to realize there's got to be something to this trauma. And also, he had his first official opportunity in 1981, University of Munich at Tübingen. He was the head internist of the oncology clinic for reproductive disorders. So he wanted to find out that every patient, every person he was able to test upon, he wanted to find out if they too had a shock before the onset of their cancer or disease. And to his surprise, he found consistently. And together, he was starting to correlate using the brain CAT scan, and he was doing research with the CAT scan. He was noticing that, I'll explain later about the target ring. He was able to verify on 3 levels: the psyche, the brain with the CAT scan, and the organ, the organic symptom. Then that's when he started to call it the iron rule of cancer at that time. Of course, later on, it's not just the iron rule of cancer, which is the first biological law, it's a shock, and it's named the DHS, named after his son. Then later on, he was exploring, and by 1987, he came up with the 4 biological laws, and then it led to culmination of, in 1995, the 5th biological law. Okay? Now, these are the 5 biological laws, and this is something when I work with people I always have in mind. And what's really cool about this, I would say, that this exists not in human, but in animal and even plant. All have, everything in life has the 5 biological. It's following universal principle. And I could talk more about that in the webinar. It's really a wonderful philosophy, and it's a provable science. Number 1 is the iron rule of cancer. That's the shock, the unanticipated. And we will go more in depth to have a better understanding. The law of 2 phases, development of disease. Dr. Harmer was the first one to categorize all the diseases into the cold phase, which is 40 to 50%, the hot phase, 50 to 60%. Okay? Then the third, which is more embryology related, is ontogenetic system of tumor and cancer equivalent diseases. Now the cancer equivalent diseases are like the dysfunction, like multiple sclerosis, diabetes, and stuff like that. And 4, this is where we may have to apply the 4th biological law. And I like to tell a student, and I had to do this when I had to learn the German New Medicine. Well, back then it was called the New Medicine when I first got into it. That was back in 1999. Now, the ontogenetic system of microbes. We were all led to believe, or most of you, that they are the enemy, but they're not. We actually evolved with them. And it contradicts the medical system with Virchow, or even Pasteur, that diseases are not in the cells themselves, or virus or genetic defects, any of that. And even further, what Dr. Harmer came up very, very important was the 5th biological law is a biological meaning. Everything has a biological meaning. Now here's the first important rule. No illness outside of poisoning can occur without a shock or an unanticipated event. Okay? Now, unanticipated event is something that's very meaningful and something that is very important that catches you off guard. And the next slide we have here is highly acute, dramatic, because it's very important. It's unanticipated, isolating experience that simultaneously affects, really in a split second, psyche, brain, organ. It happened before you even have a chance to think about it. In fact, Dr. Harmer said in his literature, it does the thinking for it, or influence. Once we have the DHF, the unanticipated event, it has influence in our behavior, and it can form core belief system. But more importantly, on a psyche level, it's been programmed for our survival. And many patients experience what they call a shock. And it's like a lot of patients will share, not all patients will immediately remember what it feels like, but it's more of an experience, not something you recall as a memory. It's like a lightning bolt, something you internalize, and that internalization relates to the intensity of the conflict. Now, some people may not remember at first the onset of the disease. For example, I don't know if you know about the 4 neurotransmitters. You have the frontal lobe, which is dopamine. Now, if we have a conflict in the parietal lobe, which is acetylcholine, which is brain speed, in that area, if you have the scientific chart, which you can order from New Medicine, www.newmedicine.ca, and here, an issue of separation affects here, people may not remember it first. Now, when I work with people, I find out what they're displaying, how they're sensing the separation, and a lot of time they may not remember it first, but how they sensing by helping to understand the nature of the conflict. I'll get into more of that later. Or it can happen where 10 years down the line, they have a similar episode that reminds them of the first time, then they experience the internalization of it. And also, you're going to find out, contrary to a lot of people believe, we don't get sick with some stress. We can also have major diseases from the healing phase. I will tell you about that real soon. Now, the brain mediates between the psyche and the organ. At that moment, we will have a target ring that relates to the specific organ. Now, some of you may wonder, why would it go to a certain area of the brain or a certain organ? It's the content of the conflict, like I mentioned before, separation. Now, if it's the back of the head, that part of the brain, it will be like fear coming from behind, or maybe some of you may notice, a lot of people have floated, okay? Or if it's the temporal lobe, we may have hearing conflict. You show up that kind of side of the brain. If it's the frontal lobe, it might be the thyroid, sense of powerlessness. And once again, that unanticipated event, how you're sensing, like if you feel powerless, out of control, it would affect your thyroid. Here, you will see the location of the target ring. Now, to be honest with you, I wish every CAT scan looked like this. This has been taking place within 48 hours. And the ring, you can even see the outer ring, very concentric ring. Not everybody is going to think about having a CAT scan when something happens to them right away. It would be nice, maybe it'll get to that point. But over time, when the conflict downgrades, so that the target ring will be less defined. Okay, but still, with practicing the trained eye, and I hope to teach that in level 5 in Australia in the future, but first we got level 1 to 4. Now, the specific location, what you're seeing here, now in the old days, when we have a black and white 14 by 17 CAT scan, you'll see the name, but we actually turn it over, you see the right side. And what you're seeing in front of you on the right side is the right hemisphere. Now, of course, with basic science, you know, especially up here, the right side of the brain controls the left. So what you're seeing here is a separation and a motor where the person has a paralysis and loss of sensation. Now, I was mentioning about the computerized tomography. You know, it's amazing. When I first saw Dr. Harmer, this was when I was back in 2006 in Malaga, Spain, and I never forgot that one of the first things he saw was the trauma I had under my rib. I was an abused child where my father picked me up the elbow, he just threw me against the wall type of thing. And he noted that it was a very traumatic shock in my rib. Well, he noticed other things as well. And also my colleague Isidore, she became very convinced where when her CAT scan was read, that he was able to pick up the melanoma and the breast lump. So she was sold on that, and I am as well. Now, on the CAT scan, you can determine whether it's active or resolved. What we're basically looking for activity, whether it's a conflict activity, which is the stress phase, and resolve, which is a healing activity. It will become clearer as we go along. Yeah. So what happens when we have an unanticipated event? In that brain relay, you have neurons, and they're breaking down. And how much they break down is according to the intensity of the conflict. And it will say that destruction will continue until the conflict is resolved. Now, the part of the brain, once again I mentioned earlier, is the content of the conflict. Will determine which brain level. Now, there are four main areas of the brain, and later on I will show you there's three embryology layers that relate to that. Okay? Now, what's important is when we learn about German new medicine, we have to understand that this is a pre-programmed response mechanism for survival. It's the same mechanism in plants and animals. Now here you have the target brain, and this is the liver, by the way, and this are called liver nodule. Each one of those represents the activity of growth. Now this is considered the old brain of the liver, and this is a very sharp target brain, and this represents growth. And a little bit later we'll get into the second biological law, and the third biological law will determine the behavior, whether it's in the old brain or the new brain. Now, of course, most people will probably be aware that whenever we have a shock, doesn't mean it's going to be the liver only a target brain. You can also have the target brain also in the bone, the skeletal structure, that simultaneously relate to also on the brain. And what you might find interesting, in the fall, there's a shock with the weather changes, and you also will see target brains on the leaf as well. It's consistent throughout nature. Now, the degree of manifestation depends on the conflict mass and conflict duration. Now, this is just basic stuff. So the manifestation relate to how important it is. Now, let me just give you a quick example. Now, if you knew a city where all the drums hang out, or the wino, and you're probably prepared for that. Now, if you went down there knowing that ahead of time, if somebody comes out to you and call you a name, probably wouldn't bother you. But if you knew a minister that you highly revered, and you never thought in a million years they would put you down, if you were to go there and it happened to be that minister, call your name, it might be very important to you, totally unanticipated. So, now, the duration of it, later on with the webinars or seminar, we'll understand, track how they relapse. But for right now, the duration of the conflict will have a lot to do with the activity on the second phase of the healing phase. Now, Dr. Harmer, unfortunately, even today, the radiologists are still saying artifact. They still want to suppress its work. But what Dr. Harmer did back in the 1980s, Uh, he investigated. Now, the company in Germany, I believe they were the first one to make the radiological instrument, and he wanted to confirm what he was doing, that it's not artifact, it's true target ring. And the basic difference that an artifact will have a single ring, but if you change the location or go to another layer or a different angle, it will disappear. However, a target ring, just like I showed you that the shock, is a sphere of electrical activity. So whether you change the side or go another layer, you will still see that target ring. And that's the basic difference. It's visible with shift, multiple rings, like different images. Okay? Now here you see the conflict act, and you see the target ring nice and clear. Now the next slide, you can tell it's darker and the ring are broken up, and also in the center you will see what we call edema, and the repair phase is called the glia. Okay? Now let me just go back to the slide before. You see the sharper ring on the active phase, the first phase. Then in the healing phase, and you can tell that the CAT scan as a whole is darker because there's swelling. So it's a connective tissue called the glia. Okay? Now, earlier I mentioned about the conflict mass and duration has a lot to do with, in certain cases, you may develop in the healing phase a brain tumor. Okay? And that is also a healing phase. And once again, you also find a correlation with the brain tumor with the related organ. Now, biological, psychological. This event must catch you off guard. It must be unanticipated. Now, the psychological conflict does not create disease. Why? Because it's unanticipated. It's a moment of anticipation when it's coming enough to prevent the DHS. I will give you an example of the the drugs in the city. Now, I'd like to give you an easy example about a psychological. It's actually a real case. Just a quick example that might clarify it a little bit. There are 4 daughters in the family, and they know ahead of time the father having a terminal illness, and they were already prepared for him to die. One of the daughters, in this information, she shared wonderful memories with the treasure chest. So the father who had died said, "You can take it home with you now. Okay? You can have it right now. We have wonderful memory." Now, the reason why I say wonderful memory, it was very important for her. It's like she kind of digested sitting on the stomach, okay, on a psyche level. So, later on, after a couple of years or so, the father died, and there was an announcement later on at the estate. From that, she received a surprising news that that treasure that she had went to her other sister. Okay? And after that, she got really sick. She went to a psychotherapist. They thought, well, he had a lot of stress. It was hard with the daughter dying. But that doesn't make sense, because why would she get sick, but the other 3 daughters doesn't? It's the element of surprise that caught her off guard. Is that treasure chest was, excuse me 1 second. Okay, good. Thought I had a message here. completely caught off guard and was sitting inside. It's like all of a sudden it pulled out of it, and she developed a pancreatic cancer. And also, I also had a pancreatic case, and same meaning, psyche sent, but the details will be different. But we sense the same way, just like with animals as well. Okay? Now, so law of two phases. Every disease has two phases. That depends whether the conflict is resolved. In other words, it will stay in the one phase when there is no resolution. Okay? And Dr. Harmer found 40 to 50% of all diseases are in the cold phase. For example, osteoporosis or anemia, bone loss. And the hot phase, leukemia, where instead of anemic, low RBC, white blood cell count, platelets, whatever, you will have, once again, increase of white blood cell in the healing phase, the hot phase. And this is all what it began. Now, speaking of cancer, Dr. Harmer said the reason why traditional medicine won't find a cure for the cancer, not only they don't consider the psyche, they don't understand the vegetative rhythm. And that's the law of two phases. And what you see here, the DHS, that's when it starts to two phases. The DHS, that's the new terminology. So in German New Medicine, when I say the class is open to all, whether you never studied health before but willing to learn the anatomy would be helpful, or you're a experienced MD or chiropractor myself, we're all in the same boat. There's a whole new language to learn here. In fact, I tell my students to follow this Sufi aphorism. The greatest learning there is to unlearn what you have learned or mastered. German New Medicine is a total different domain. It will only enhance whatever you do. Now the intensity of the conflict, okay, and this is when the DHS, the unanticipated event, starts what we call symptonia. That's another vocabulary to learn. Some of you naturopaths, chiropractors, or whatever heard of the sympathetic nervous system. Dr. Harmer called it the symptonia. Now, that wavy line, the conflict, it depends on how important, how intense the conflict, and it goes up and down. Everybody will be different. In the webinar, I talk about track, or when things happen, we get more in depth in the webinar. Will determine the intensity. And once again, it all happened in a split second on the psyche brain organ. Okay? It will stay in symptonia when there is no conflict resolution. Now, what happens once we have the conflict? We're compulsively thinking about it. We want to resolve the conflict. Same thing with animals as well. There's an obsession trying to regain the territory or whatever. The target range is there, nice and clear, like the one I showed you before. It also appears on the organ. Now, the reason why I use the brain CAT scan, over time, the target range stays on the brain visible, where over time on the organ, usually the growth will override the visibility of the target range. Now, once again, in the fight and flight, we shut down the digest and we're going to have cold extremity, and we may have more blood pumping, blood pressure. And once again, for fight and flight, we'll have the poor appetite, we may have weight loss, hyperactivity resolved. Doesn't mean you're going to have all of those. It could be one of those. It depends how intense it is. And you'll wake up at 3 o'clock in the morning. Wonder what that is. This is the mechanism that we have a head start for our survival. Now, those of you, I'm pretty sure it's popular in Australia, the early bird catches the worm. That is absolutely right. The earlier you get up, the more you have a chance for survival. Okay, so I find a lot of patients waking up at 3 o'clock in the morning. A lot of times they'll have flashes or images, and a lot of times they may not understand why they're compulsive about it. And that's why we need to educate them with awareness the nature of the conflict. Now, some cancers, adenocarcinoma, this is the old brain. Adeno is more like glandular. Now, you can have functional, now let me back up. The adenocarcinoma are the one that grows. Now, we're going to get into that later. We just want to introduce to you. Now, functional disturbances is more like dysfunction, like diabetes, multiple sclerosis, some visual, I was mentioning about the floaters in the eye, sensory loss, and this is directed by the new brain, the cerebrum. Now, once we have the conflict, okay, everything changes. So whatever intensity it was in the first phase will determine what kind of activity we're going to have. And what you see there, CL. Dr. Harmer has studied Latin and Greek. And also, by the way, talk about what a genius he is, besides being a hero for me. He was still the youngest person to graduate from medical school in Germany. And after he graduated, he felt he wasn't mature enough. He went further. He got a theology degree as well. He was also a doctor of theology, so he had to study Greek and Latin. Anyway, it's an amazing man. Now, the CL is conflict lysis. Lysis means breaking up the conflict. Okay? And then we're going to talk about PCL phase A. P means post conflict lysis, A. And in the middle, epileptic. And we'll talk about the second half, PCL phase B. Just want to introduce you, repetition. And you probably heard that repetition is the mother of skill. And it's very important when we learn from the webinar to seminar that we recognize this when we work with our patient. Okay? Now, PCL phase A. Remember I said, if they're thinking about it over here, when you have the conflict resolved, it's going to be the opposite. They stop compulsively thinking about it. They're more relaxed. And sometimes you might feel they're depressed. They're really not. It's more not really motivated. They can just relax. I don't need to fight and flight. We'll cover a lot of schizophrenic, manic and depressive. That's in level 3. It's really fun. And Dr. Harmer has mapped out the entire brain. When I'm talking about the gray matter with schizophrenic, like autism, all kinds of things like that. Now, in phase A, vagatonia, that's a new terminology. Now, a lot of you practitioners may know it as parasympathetic nervous system, which is eat and sleep, in contrast to the fight and flight. Okay? Now, instead of constriction in the healing phase, you have an expansion of the peripheral blood. You get warmer hands and feet. The appetite turns to normal. You may gain weight. Now here, you have a problem going to sleep. Now, when you have patient or yourself having trouble falling asleep before 3 a.m., you have resolved something, or you're still in the what we call a hanging healing. In other words, you haven't got what I teach in the webinar, track, things that your psyche stored at the time of the unanticipated event. And those are with the sense, eye, ear, how you feel, and all that. This is the indicator of the healing phase. Now, once again, not all diseases come from stress. In the healing phase, you're not really stressed. Once again, you're not supposed to be thinking about it. In here, you have arthritis, fibromyalgia, some cancers like infection, colds and flu, allergy, ear infection, skin eczema, psoriasis, hives. In fact, all the skin diseases, with the exception of melanoma, are healing phases. Okay? So they're definitely in the healing phase, and it's directed by the cerebrum of the brain, the new brain. Now, earlier, what you see in the middle there is epileptic or epileptoid crisis. Now, epileptic, which is the same in epilepsy, this is what you commonly hear about, the shaking, the motor tremors, and all that. But you can also have epileptoid. An example of that is heart attack. Okay? And one thing I want to mention that I really look forward in level 3, like this is wonderful life-saving information. I would love when I come to Australia or somebody on webinar, like an emergency care clinic, if they can understand the difference between a coronary infarct versus a myocardial infarct. A lot of them don't realize with a coronary infarct, when they give them sedative and fluor, they're actually killing them faster. So anyway, there's a lot of life-saving information. Anyway, so let's keep going further. So this is also known, a lot of you heard, healing crisis. Now in the middle, we have almost like the Einstein formula, energy equals mc squared. This is the EC equal the DHF. So reliving what happened in the first phase. Actually, in the PCL phase A, you have the inflammation. But in the middle of the healing phase, the epileptic, it's like Mother Nature provides a sympatonic spike to be able to cut down on the buildup of the inflammation on the organ as well as the brain relay. And also we have sympatonic changes in the hormone, like thyroxine, which also elevated in the conflict active phase. Okay? And this is where we have mitosis. Okay? A lot of the tumor markers go really high in the middle of the EC, but they don't realize they're in the healing phase. Okay? Now, also if you hear someone passing blood in the colon through the night, and it doesn't have to be a major crisis, they just heal their conflict. Okay? Now, and also from the EC, when I said the first part is compressing inflammation, removing the inflammation, the water and all that. The second half is increased urination, the natural process, which will go to phase PCL phase B. Now I mentioned before, it can be life-threatening. Now this is just a few cases. I'm talking about heart attack, myocardial infarct. Now sometimes with diabetes, we have to be careful. But I'll tell you about it later, like the ideal hospital or sanitarium, where all these things could be provided. I'll mention that later. So with the beauty of this work, we're no longer programmed by the thought the disease to come out of nowhere. By understanding the 5 biological laws, the nature of a conflict, how the organ behaves, we can predict when it occurs. Okay? That will become more clear want to teach a level 1 to 4 in webinars or seminar. So, for example, even the sneezing, having a chill, a stroke, diabetic coma, seizures, loss of consciousness, that's when you have a separation, leg cramp, or anything that twitches. It's the epileptic crisis, okay? Okay? Now, PCL phase B, after the EC, is heading toward normaltonia, providing we have no conflict relapse. Okay? It will go to normaltonia. Alright, now also, just to let you know that we're not just going to have one DHS in one phase. You can have 5 DHSs, some in the active phase, in the first phase, some in the second, being all types of combination. Now, the third biological law is the nature of the shock and the ontogenetic system of tumor will let us know about the cellular structure that is affected, depending on the nature of the shock. Now, there's 4 areas of the brain that control 3 types of cells in our body. Now, these 4 areas, now the brain, which is behind the ear at the base of the skull, there you have the brain stem, the oldest part of the body, the oldest evolutionary part. Then the second one is the cerebellum. That's the next layer. Then we get to the cerebral, the neurobrain, the cerebral medulla, and the last part of the evolution is cerebral cortex. I'm just going to give you a general idea. We were at one time circular ring formation. This is the survival, food, air, water, shelter, ingoing, outgoing. It's all with the brain stem. As we evolve, moving from our base where we come from, we need a sense of protection. And that's where the cerebellum comes in. That's where you have reptile skin, like the turtle shell, okay? And worm-like reptilian movement. And that cerebellum is the old mesoderm. I will tell you that real soon. The brain stem is the endoderm. That's the earliest germ layer. We'll cover that in a moment. Now, you probably heard of the gray matter and the white matter. Once we're able to protect ourselves from the sun, how we cool ourselves with sweat, whatever, then we're ready to, the next day of evolution, to be able to make a stand. That's muscle, tendon, bones, and ligament. And that's the white matter there. Then, once we're able to validate our existence to make a stand, so to speak, then we can relate to one another, and that's the newest evolution, the cerebral cortex. Just a general flow that might help you. Now, the third biological law. Now, this may surprise a number of people, especially with the immune system. Now, once we have the pons of the brain stem and the old mesoderm, okay, endoderm I mentioned, survival organ, liver, lung, and all that, and surrounding protective cover, the old mesoderm. Once we have the DHS, it actually multiplies according to the intensity of the conflict, depending on the content of the conflict. And then, the healing phase is cell destruction. Now we'll go to the newer part, the new mesoderm and ectoderm. Cell destruction in the DHF or loss of function like multiple sclerosis, diabetes. Now, cell destruction like skin, okay? White flakes like the psoriasis. And in the healing phase, regaining like redness and psoriasis. That's the healing phase. Actually, psoriasis is both conflict and heli at different phases. I'll cover that more in level 1 and 2, and further in level 4 we get into deeper function of the organ and tissue. Now, the brain control each germ layer and how it behaves at the moment of the unanticipated event of the DHS. This new concept completely overturned the hypothesis of metastasis. Now, you might find it interesting when I make this statement, is that the original hypothesis goes like this. Somehow, the cell of the primary tumor swims through the periphery, so circulate the lymphatic system or whatever through the blood, goes to another, let's say example, a germ layer, expect that to change to copy where it came from. For example, if you have the endoderm with growth in the first phase, let's say the liver, and then it's supposedly this hypothesis has never been proven, attach itself to the bone, and the bone is supposed to grow a cancer. It doesn't work like that. Once the fetus is fertilized, the ovum fertilized, is already formed. It cannot transform to a new germ layer. Now, this hypothesis, believing that cancer cells can swim to the blood. Now, why is it that they don't do any blood screening process when you give blood? Okay, but anyway, you might find that interesting. Now, once again, metastasis is completely misunderstood. Okay? It's just another shock. For example, if you have a woman with breast cancer, and sometime from the breast cancer, all of a sudden it goes to the liver. She may be in the shock, not only just from the prognosis, but wondering if her husband will be able to take care of the children, that they won't starve. Okay? So, Dr. Harmer has made a lot of sense with these. And also there's a lot of unnecessary, like a woman with breast cancer, you have to take out the lymphatic as well. There's an explanation for that as well. I covered that more in depth. And as mentioned before, once the primary germ layers are set, the endoderm, mesoderm, and ectoderm, each one of those layers behave in its own way. Okay? It will always behave that way. In other words, you don't expect a cat to turn into a cow. Now, they cannot even do that with genetics. Okay? Now, if they did, then I would say, holy cow. Excuse me for the humor here. Now, this is the one that challenges with Dr. Harmer the medical system. That's one of the reasons why in Germany, before he got arrested, the license taken away, they want him to, this is one of the reasons, to denounce his finding. Yet his was provable, and the rest of traditional medicine is based on hypothesis. Anyway, there's a lot of medical control I think a lot of you are aware of. Now, this is very interesting with the immune system. Okay? The immune system is at its optimum in the conflict active phase, the cold phase. That's when the immune system is high. But once we have the resolution, the microbes become active and the immune system goes down or downgrade. Okay? Contrary to what we thought. But some of you can relate to when you're under a lot of stress trying to get ready for your vacation, and then once you're able to go on a trip, you get sick. That happened to me as well. Now, this is a very important slide I tell my students to really understand here. Everything is color-coded, just like in the book here. And the first phase that you'll see in yellow, you'll see the yellow color. That's the endoderm. On the right, you see fungi, and on the left, from the center, is brain stem. The fungi, and once again, the endoderm is the oldest germ layer, and the fungus is actually the oldest microorganism. Okay? And believe it or not, we have evolved with these microbes. They are not the enemy. Okay? Microbes are not the enemy. They are in a symbiotic relationship. In the conflict active phase, the bacteria, mycobacteria, I'm also saying the fungus, they multiply according to the intensity of the conflict. And that day, they're apathogenic. They won't cause any disease. Okay? It's only when the healing phase, they become pathogenic. Now, viruses is something that you might find very interesting. They have never proven that the virus actually exists. Okay? And also what they talk about RNA, DNA. They said there's no reverse transcriptase. That's not true. Excuse me for the technical term, but if you want to know more about it, alright, Stefan Lanka. You just do a search online, Lanka, L-A-N-K-A. Stefan, the first name. He is a world-renowned virologist. In fact, he was the first one to find a virus in a microscope, but had nothing to do with the two phases. In fact, it's not a conflict at all. He found a virus coexist in a symbiotic relationship in a primitive life form, nowhere near the advanced species of plant, human, and animal. And what's interesting is what they're telling you that it's just antibodies are being formed. It's like an allergy test. And Stefan Lanka said the HIV is complete nonsense. But if you want to read about it, just go online. The antibodies that we're talking about, that happened in the healing phase. Okay? So, and also, the other thing we have to get things turned around here, for example, women with cervical carcinoma, cervical cancer, they say that the human papilloma virus that caused it. No, complete nonsense. As a matter of fact, not all the time human papilloma viruses are around the cervix. There's other viruses. What that means is they get it from the environment. Once the healing phase has occurred, then the virus is actually a restoration of the tissue. However, there are other things that I teach in the webinar and seminar why they have overgrowth. There's other factors, but right now I just want to give you the basic idea. Like in all things, everything has a biological meaning. Even cancer is a natural biological meaning. So it might be challenging for people, but we have to take the time to educate people what is that all about. I'm going to give you some example as we further. Diseases or conditions or anything are meaningful, special biological program of nature developed from evolution from day one to resolve an unanticipated biological conflict. It's there for our survival. Okay, one of the kidney tubules. Biological meaning, conserve water, maintain a longer survival time. Like when someone gets a bad prognosis, someone in a wheelchair or in a hospital, you might have heard or seen swollen ankle, water buildup, conserving water, sensing survival. And one of the great discoveries Dr. Harmer, I covered in the webinar and seminar, is the kidney tubule syndrome. Ectoderm, coronary artery, when there's a conflict, like a deer loses the territory, the tissue breaks down, become a bigger coronary artery to pump more blood to regain the territory. And here we have increased blood flow, increased performance. One of the things, ever since 1999, I made sure, that's when I first got involved in Germany medicine when I was in Europe, laterality is so very important. The right-handed person, partner, left side, mother-child, reverse as a left-hander. Right hand will be on top. Right now I'm just going to show you just basic. We have other forms of testing to determine laterality, but I just want to expose the idea right now. The left-hander will be left on top. When someone does not clap one on top of the other, we call it pataqué, or clap like a penguin. We have to perform other tests. Usually in my experience, also in my colleague, they could be left-handed. Very important is the relationship. Now, when we say left or right, it has nothing to do with your left brain, logical, mathematical, or right brain, writing, rhythmic, or whatever. It's about the nervous system, handed or dominant. Okay? The organ that relate to laterality are the breast, ovary, the testicle, striated musculature, skeletal. For example, if you have shoulder problem, if you're a right-hander, you may believe that you're a bad partner of some sort. That also relates to myocardium, the skin, the hair, the eyes, even our hearing. Now, the first day when I saw Dr. Harmer, which was arranged by Isadora Laker, she wanted to, she now live in Hawaii, to spread out to Pacific Rim. She introduced me to Dr. Harmer. This was out back in 2006. And the first thing he said to me was, he didn't say hi, he said, in a thick German accent, the patient is the boss. And this is exactly what he's talking about. The patient is the absolute boss of any procedure regarding its health. Now, I explain more of that in the webinar, but let's just give you a general idea. Through their awareness, of course, when we understand ourselves, we can understand others. We coach them, understand the nature of the conflict, and they can sense what is best for them. Okay? And the patient, by educating them, must work out the best therapy for themselves. Now, there's three levels: the psyche, cerebral, organic. Now, the psyche portion, and there's a therapy in three places. Practical psychotherapy with a sound human understanding. Now, I mentioned to some of you, it's a form of talk therapy, seeing disease through the eyes of Mother Nature. But in a way, it's more like, if you want to call it psychotherapy, it would be directed psychotherapy. Because when we listen to people explain, we can direct to help them be aware of the nature of the context of their conflict. And in my seminar, I talk about TRACK, how to prevent relapse, to make sure that we do the best we can, not only to resolve the conflict, okay, and understand what currently triggers them that relate to the past. In other words, we don't just want to jump right to the memory. We want to help them be aware why is the footprint over here that they're reacting to in their environment that relate to when they first have the DHF. I'll explain more of that in my seminar. Now, cerebral plane, observation, for example, with the CAT scan. But also, it's going to tell us about, like, for example, if we did have a patient, like Dr. Hammer would give cortisone to prevent heart attack. You want to slow down the swelling of the brain that shuts off the impulse to the heart. Now, in some cases, if we have a coronary artery, long-standing, we may not even want to touch them. We just give them hawthorn berry or other nutrition. They can still live a long life. It's something we don't want to resolve. Let sleeping dogs lie. Now, treatment organic complication, for example, diabetic home, you may have to give them blood sugar, orange juice or whatever, but you will know ahead of time based on when the conflict resolves, things of that nature. Now, the most important thing, diffuse any panic associated with the diagnosis. Now, we actually need to retrain medical doctors that you don't scare them to death with the prognosis, but to educate them what the patient needs to do to take charge of themselves through the understanding with the 5 biological laws must be understood in the context of their disease. The more they understand it, the less fear they're going to have. Okay? Once again, laterality. We're talking about the therapy now. And it's very important to find the DHF. Okay? Now, in the conflict active phase, fasting and special diet are contraindicated because the vitality is very low. You do need vitality along with the healing phase and all that. You know, good nutrition is important. All those things help. But once again, the Germany medicine is not going to replace what you do. It will only enhance. And it's a wonderful strategy, if you will, that the patient can empower themselves through the understanding of the 5 biological laws. Okay? Now, if they don't resolve the conflict, you may be familiar with this word, kakechik. You're wasting away. That's where they lose vitality. For sure, you don't want to do any fasting or even drinking urine therapy. Well, anyway, if they can do that, that pissed me off. Sorry. I didn't mean to make you laugh. They shoot me. Now, so also excitement of any kind, because we don't want to create any sense of relapse. And also they're very fragile because they're trying to understand the nature of their conflict. And we don't need any more bad news or whatever. You don't have a new DHF. The ideal hospital does not isolate the patient. And Dr. Hammer did have at one time the ideal hospital. It was in Austria, but it was closed down. Now, they went in and got his file for the past 10 years. 3,500 cases. 3,000. I'm talking about death door people. 3,000 of them are still living. I mean, it's amazing to go past 5 years, but 10 years is something else. So incredible high success rate. The reason being they understand the 5 biological laws, they have faith in Dr. Hammer, and this support system, for example, now German medicine is not some fanatical religion. Now, the reason why I bring this up, I have other so-called teachers of German medicine make it like a religion. Like, for example, unfortunately, there was a leukemic patient that died. He was in the middle of the epileptoid phase because his other GNM practitioner saying, don't go to the hospital and all this stuff. And if he would have had the blood test, we would have known he was very low RBC because he had trouble breathing. It was very low red blood cell. A simple blood transfusion would have helped him through the EC. He would have lived. Okay? So that also means the ideal hospital to be prepared for any emergency. and especially in the epileptoid crisis. And I cover more of the condition in the webinar and seminar ahead. Now, we're getting close to question and answer time. They're much better than Perth. I have a lot more time. This is copyright material by Dr. Reiki Goodhammer. Ilse-Dora Lake has done a very good job working with Dr. Hammer, the presentation. And of course, I am the presenter for the Pacific Rim. And I appreciate you all being online here. Now, upcoming webinars and seminars of 2012. Level 1 and 2, 2-day seminar, US dollar, 10. Oh, I need to change it to March. I have an error here. Excuse me, 10th to 11th of March. It's not May. I apologize for that. It's March. I need to change that. Now, the level 1 to 4 week-long seminar is $1,500 US. Now, in the next 24 hours, if you register to Pacific Seminar Pacific Rim at newmedicine.ca, I will give you $100 off. So let me know in 24 hours. And the location, this is May and June. Brisbane area. I thank Rose and Will. There's potentially a lot of people. Now, the reason why I have 2 different weeks in Brisbane, I won't take more than 25 people. If there's 30, I'd rather do 15 than 15. The seminars are more experiential, where the webinar, it's a lot easier to pump the information out. Okay. Also Perth, that you see there, and Cairn, 23rd to 29th of June. Okay? So, now if those of you that have questions, when you, next to the tech chat, if you click on question and answers, okay, look like there's, okay. Question, and I'm just going to display the question. I'm just going to take it as they come. Just hang on. Okay, I'm going to take it one at a time. Let me just see where we are. Okay, I'm going to do this first. All right, let me just go with the biologist's name. Okay, Chris, I'm going to go to the tech chat right now. And I'm going to, everybody go to the tech chat. I'm going to type in the name here. Okay, I'm going to go back to the, so that will stay there. I'm going to go back to the question and answers, okay? Okay. Okay. Let me just do this first. Psoriasis. Well, instead of SC, it's P. That's okay. I think everybody knows what you're talking about. Now, when we say a very young person, once again, in level 1 and 2, we cover stages in the fetus, okay? After certain parts of the body is formed, the baby is susceptible of having the DHS while in the womb. I don't know how very young. Now, in psoriasis, there's an active and healing phase. In fact, with a lot of allergy, I have seen psoriasis are more red on one side and white on the other side. Now, usually there's a mixture, and also the located. If they have it outside the elbow, it's, once again, it's all about separation. If it's outside, they want to separate, or separate from. Or if it's more inside, they want to embrace, they want to connect. once again, it's separation. So, so I don't know exactly when you were very young, but the way I would approach it, let's say, almost like the day they were born, it reminds me of a case. I have a woman who had a skin problem, and okay, and I had to resolve it through the mother. There's always a very strong bond between the mother and the child. Okay, and it would be wonderful examples I could give you, but before you can understand that, you have to understand the nature of the conflict and understand how to display before you can get along. And it's amazing, once you're able to get them to release, you can get immediate changes very quickly. I've seen that in the seminar. That's one thing about the experiential seminar. When we talk about, people in the group can feel it. Okay. All right, there's more I can say about it. I want to go further now. Let's go with the... it all depends, okay? Now, for example, of course, it depends on the intensity of the conflict. Now, heart attack, once the healing phase could be 2 to 6 weeks. Now, in the old brain, it depends, once again, there's really no set time frame. Also, you got to remember, they may have a high active phase, and everybody's different. You have to find out how is their environment. In other words, some of them may have triggers that happen more often than others. That will also determine the time frame. Okay? But, there's a similar rule of thumb. Now, on the other hand, also the germ layer, for example, the ovaries, okay? And with the ovaries, once you have the healing phase, they go to 9 months of maturation. Now, this is another thing that is life-saving. I have seen women, when they have the conflict resolved, but they've been operated to take the ovary out before the 9-month period, all hell can break loose. In other words, all the attachment that the ovary used for blood supply, it's difficult for them to get it all out. There are cases where it may grow another 9 months in different areas. And that's why they think they have to complete hysterectomy. But if they wait at the end of 9 months, okay, they can do the surgery, they can take it out all in one, effortlessly, because at the end of 9 months, the attachment to the ovary, the adhesion to the different, the liver, the colon, and all that, naturally breaks off without any complication. Okay? All right, good. So, now, okay, let me go with the, there's a good question here I'd like to address here. That, all right, let me read it out loud. I guess you can all see it. I'm a little puzzled. My husband has been diagnosed with epithelioid mesothelioma. He had a fall on the roof a year before. As a builder, this is not unusual. His diagnosis took that long as he presented with shortness of breath and asthma-type symptom. It showed vasculectomy, that he had epileptoid mesothelioma. This was a result from 10 years in the fire brigade to build a stent. Using a Beptide product, do you class it a poisoning? Very good question. Now, he had such good health and until then. Okay. let's take it down to two parts, okay? Now, I want to tell you this. This is also an opportunity when you hear the word syndrome. I'm not saying this is a syndrome necessarily, but you approach it the same way, because when they say unknown etiology, there's a whole bunch of DHS. Here, you have a DHS from the old brain, unanticipated event, and a DHS in the new brain. Now, those of you who don't have medical training, if you get the medical dictionary and look up the root word, you're actually going to have, you don't have to, like I had to do, how to deprogram all this hypothesis. Now let me just go here. Epithelioid is epithelium, that's ectoderm, and that is separation, okay? Now, mesothelioma, this is the, earlier I mentioned about the brain stem, okay? Lungs is one of them, all right? But the covering of the lung is in the mesoderm, and that's protection, okay? Now, it's actually the sense of attack. Now, the root thing, he felt, it's like a sense of attack, or when you think about a asbestos, it's all about the sense of attack, trying to protect the integrity, okay? Now, once again, the asbestos can breathe through the lung, but it doesn't get to the outer covering. I'm not saying asbestos is poison or toxic. Now, here's the thing. This is the same argument. Like, I don't know if you're familiar with hair analysis, where you can have levels of mercury toxicity. I have seen, okay, people claim that because it's mercury poisoning, create MS. And I have seen people with really high, very high amount of mercury poisoning, no symptom. But I have seen myself, with Dr. Robert Canary in Belgium and all that, people having a DHS in the teeth, even a little amount of mercury, it's not the amount of toxin, it's whether they become toxic. If it really gets to your extreme, it can be like a poison. There's a very fine line between toxin and poison, okay? But things can wreak havoc if there's a DHS. Now, the asbestos can become more toxic when there's a sense of attack, okay? Now, the thing with the fire, the smoke, those are the things that relate to the tract, and those are real experience. In my classes, okay, with a webinar and seminar, I'll teach you how you can differentiate, but they sound different from thinking, the real experience, virtual and symbolic. Now, going back to the asthma, that's the new brain, that territorial fear. Now, you can also have a sense of separation, okay? Then we have to find out what is separate. And also with a laterality, I need to find out the laterality, which side it is, and things of that nature. That's how I approach. Of course, now if you give me your email, more of a case history, or if you want to wait until I come down, I can work with that. Okay, Lois? So let me, because of the time, I want to answer more questions, okay? Now, okay, common cold. This is the healing phase. Alright? The reason why I smile is, I had a case last year. He was having this flu-like common cold symptom, and he wanted to challenge me. God, you know, how can this be a healing phase and I'm having this mess here, okay? In his case, there were two things. There was distinct conflict, okay, and together with the territorial fear. What happened was, a few years back, before his father died, they had this big dream about investment. And once again, we'll talk about primal sensitive territory. And he gave a lot of his money away for this investment. On the day he heard the news that it was all taken away, he was very upset, very angry, because this is a very good question. Thank you, Will, for this, because you can have negativity or positive attitude, has nothing to do with it. He got an answer, that was his resolution, but he was very negative and really very angry. He wanted to a healing faith, okay? But he got his answer. However, later on, we'll talk about the kidney tubule, what prolonged the cold, because all of a sudden, he was worried about existence financially, would prolong it. So I work on the kidney tubule, all right? Within 1 or 2 days, he was already in the healing phase with the cold, just work on the kidney tubule. It was over within a day and a half, just like that. It's amazing, okay? Now, I'm not saying that's the only causes of it, but I'm just giving you an actual example, okay? And of course, different tissues relate to different conflicts as well. Okay, let me just scroll down and see more questions. Okay, now, does a shock event weaken the immune system? The answer is no, okay? Now, I'm coming from a perspective, Simon, that once we have the shock, okay, like I mentioned before, the mycobacteria, fungus, are elevated, okay? This is when the immune system is high, okay? Once we have a resolution, now he may have a negative attitude or stuff like that, like I mentioned before. Once there's a resolution, then the immune system goes down. Now, that's when the microbe comes down. You know, I don't know if you ever heard of pirate patches. I'm going to go to the tech chat, and some of you may have heard of, excuse me 1 second. Where I'm going to go back to the question and answer now. When you go to the tech chat, I put down pirate patches. Medical professionals don't even want to talk about it. These are patches in the lymphatic system that purposely allow the microbe to come in. And they don't understand why. Even genetic, they're tumor depressors and tumor builders. They don't understand that because they don't understand the German new medicine. And Dr. Harmer said, once again, they won't find a cure for cancer because not only about the psyche, there's 3 aspects. They don't understand the vegetative rhythm. Once they understand that, then they have a chance for the cure for cancer. Okay? So, let's go to a different question now. Hi, Simon. Let me go to... okay. Thank you, Simon. I really appreciate putting the question in. The cross-section, all right, once again, it's axial when we have the brain CAT scan. And once again, I mentioned about artifact and target ring. Once we have the DHS, the biological shock, in a split second, simultaneously on the psyche, the brain organ. On the brain, the target ring will form in a split second. Okay? It's not part of the anatomy. It's like the electrical impression. Okay? It will be a sphere of activity. And you'll be able to see it with different images. But of course, that depends on nowadays. Things have evolved, and I'm really happy to see that back in 2001 when I did my first one, it was just black and white film, 33. Now you can have up to 250 images. Okay, so I'll explain more about it later. Okay, now let's see any other question. Let me go back to question and answer, see if there's any more. Okay, bipolar, okay. Earlier I mentioned about level 3. I'll just mention that. You really have to understand level 1 and 2 to have the foundation for the biological law. The answer to that is the bipolar part is the activate. You have one, like on the right hemisphere. Now, if you're a right-hander, male, okay, the first conflict will be on the right side of the brain. When it stays active, you have another one, it will go to the opposite side of the brain. That's when you have bipolar, okay? And Dr. Harmon has work in the psychiatric ward, and he has mapped out all of these things, okay? And there's more I can say about it. And let me see if there's more questions. I just gave you the answer. All right, well, we're getting close to 1:30, and all right, looks like there's no more questions, and once again, I have deep, heartfelt thanks for Will and Rowan. Will did a tremendous job on the layout for the email. Thank you, Will, and Rose for her contact. And I thank you all to be online. And so thank you all for being here online. And I hope to see you online or at seminar. So, okay. So I'll just double check if there's any more questions. Looks like we'll hold it here. So thank you very much. And I'll just go to the tech chat, and you're sure welcome, everybody. And so I hope you all have